My group at Johns Hopkins does more pancreatic cancer surgery than any hospital in the United States. But at no point in the last 20 years has anyone stopped to ask, why has pancreatic cancer doubled over those 20 years? Who's working on that? Who's looking into it? We are so busy in our healthcare system, billing and coding and paying each other, and every stakeholder has their gigantic lobby in Washington, D.C., and everybody's making a lot of money, except for one stakeholder, the American citizen. We've done a terrible thing to doctors. We've told them, put your head down, focus on billing and coding. We're going to measure you by your throughput, and good job, you did a nice job. We have all these numbers to show for it. Well, the country is getting sicker. We cannot keep going down this path. We have the most over-medicated, sickest population in the world, and no one is talking about the root causes. What are our leaders doing? The H in NIH is supposed to stand for health. Somebody has got to speak up. Maybe we need to talk about school lunch programs, not just putting every kid on obesity drugs like Ozempic. Maybe we need to talk about treating diabetes with cooking classes, not just throwing insulin at everybody. Maybe we need to talk about environmental exposures that cause cancer, not just the chemo to treat it. We've got to talk about food as medicine and research these areas. 20% of our nation's kids are on medication. And as you heard, half are obese or overweight. Are they more disobedient than children in Japan? Or have we poisoned the food supply? Is this a chronic disease epidemic that has been a direct result of what adults have done to children? We like to blame people for their diseases, but maybe we need to look inward. Politicians talk about, oh, we've got a new healthcare proposal. Medicare can now negotiate the prices of 10 generic drugs. Don't be fooled. These are things in the periphery. It's not to say they don't have merits, but the proposed program savings in year one, by their own description, is $6 billion. In a $4.5 trillion economy that's expanding at 8% per year in the commercial sector, that's a $200 billion expansion. We save $6 billion. The best way to lower drug costs in the United States are to stop taking drugs we don't need.
This video is exactly the reason why I have this slogan in my office wall. If you do not eat food as your medicine, then you will eat medicine as your food. It's your health, it's your choice. You make a decision and take action.